Basically, what we do is we empower patients by offering them on-demand, personalized healthcare guidance at the first onset of symptoms.
Okay.
Right. So the way we do this is by partnering with hospitals, health systems, payers. So we enable these organizations to direct the patients to the most appropriate level of care on a safe, convenient, and cost-effective way.
Okay. Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster, with my guest, Vicenç Ferrer, the managing director at Mediktor. Vicenç, good to see you.
Nice. Thank you so much for having me.
We've had the pleasure of speaking over the years, and I've
Yes.
watched Mediktor grow as this platform that helps to automate triage. So kind of tell us where you're at today with the product.
Yeah. So basically, what we are doing is here in the States working with hospitals and health systems. We have approved use case for them, but much more focus on patient engagement and lead generation. And over the last years, we have been able to gather data, metrics, KPIs that prove how useful we can be for these organizations, right? So we are talking, just to summarize, 3 times ROI if you compare the investment in Mediktor and the revenue we are generating for these organizations. 40% user retention,
Okay.
which means that 4 out of 10 people are using our solution on a recurrent basis, which is great. And this is something that organizations love to see users engaging with the solution, because sometimes they invest a lot of money
Right.
and nobody's using it,
Yeah.
right? And last but not least, the net promoter score of 72, which is 4 times the average in the industry in
Okay.
healthcare, right? So this is something that they also like, because it's basically, the users sharing with friends and
Positive
family.
experience, yeah.
You should be using this,
Yeah.
right? So that's something that we have seen like a huge interest 2021, 22, 23,
Okay.
right?
So that's the ROI, that's the impact. Let's talk about the product a bit.
Yep.
My understanding is it's very consumer facing. It's like
Yep.
something that if I'm a patient and I've got a problem, might be urgent, I might think I need to go to the ER, the
Yep.
urgent care. How do I interface with Mediktor?
Yeah, so basically what we do is we empower patients by offering them on-demand, personalized healthcare guidance at the first onset of symptoms.
Okay.
Right. So the way we do this is by partnering with hospitals, health systems, payers. So we enable these organizations to direct the patients to the most appropriate level of care on a safe, convenient, and cost-effective way.
Okay, let's say that you've partnered with my hospital.
Yep.
And I have a fever and it's been going a little longer than I'm comfortable with.
Yes.
It's like, this fever is a little too much.
Yep.
Do I go on to mediktor.com? Do I go on the hospital website?
Hospital website.
Okay.
Because we white label
You
our
white label
solution.
it?
Nobody knows about Mediktor.
Okay. So I go to my hospital and all of a sudden there's a triage search
Yep.
or something.
Exactly. Check my symptoms. Check your symptoms.
Okay,
This is the
okay.
button that it's in the homepage, in the app,
Okay.
in landing pages, for instance.
Okay, very easy to access.
Exactly.
Is it like drop down or is it free text?
It's a free text.
Free text?
And this is very important, actually.
Okay.
That's a unique feature of our solution. It allows patients to input with her own plain words how she feels.
Okay.
So no need for selecting from a body map or
Yeah.
for a preset menu. You can actually input as many symptoms as you want at once. You can do typos, and it's for a broad range of literacy.
Okay. So just for devil's advocate, why should I go there versus, I think there's a symptom check, I don't know, symptomchecker.com, Google my symptoms, you know what I mean?
Now, there are a lot of companies out there, especially since COVID-19, they have mushroomed everywhere. But I would say that what has allowed us to stay in the industry for 10 years right now, 6 years in the States, is basically the clinical validation.
Okay.
The fact that our solution is accurate and is proven through clinical studies carried out with real patients in hospital settings, independent third parties, right? Not ourselves saying that we are very good, and that were published in peer-review magazines.
Okay.
That's one thing. The NLP feature you mentioned is another one. And then the fact that we are data-centric. So every single piece of data we gather, we can share it with the organization in a structured way.
Okay.
So this is huge insights and intel about what's happening in the environment, in the ecosystem of the hospital.
Interesting. I know you were born in Barcelona, right? Or in Spain?
Mallorca, yes. in
Mallorca.
Spain, Mallorca,
Okay.
yeah.
You were born in Spain.
Yeah.
You came to the U.S. That gives you this interesting global perspective, which we've talked about before.
Yes.
How important is sort of language development. I mean, you talk about NLP, natural language processing. How important is your sort of advanced understanding of language
Yes.
to this tool?
Well, when it comes to health, you always want to access healthcare in your mother tongue. I've been living in New York for 11 years now, 13. Still, if I have a health issue, my son has a health issue, I want to access to a doctor in Spanish. So this is why our NLP is available in 18 languages right now.
Okay.
And we include dialects. We differentiate between British and American,
Okay.
Brazilian and Portuguese, and this kind of thing. So language and the NLP available in multilingual is key
Got it.
to ensure a proper user experience.
Got it. Okay, okay. So part of the product is what I'm hearing from you is part of the product is actually widening the front door and bringing more people
Yep.
to the hospital for revenue, right?
Yep, exactly.
And are you seeing any sort of shifting in priorities? Like, is that still kind of where the hospitals are focusing right now?
No, that's very interesting because I think that patient engagement, lead generation will remain relevant for these organizations. But based on our conversations, we are seeing that the attention is moving towards efficiency and productivity.
Huh.
Basically, how they can do more with less resources.
I see, I see.
Right.
Because of a workforce shortage, because of budget, whatever.
Exactly. Nurse shortage, financial constraints, etc., are shaping the ecosystem where we are.
Okay.
And we are seeing more appetite for other use cases that are more aligned with bringing efficiency to the emergency room or to the nurse triage line.
Okay, talk to me about how Mediktor actually brings efficiency to an emergency department.
Yeah. So let's picture this patient that walks in an emergency room with a low level of urgency, right, from 5 to 3. So this person is going to be served by a nurse that is going to do the triage, the intake, the check-in, right? So imagine for a moment that this person can do the self-triage in the emergency room, and this person, this nurse, can maybe devote the time to deliver care in the back office with doctors.
Okay.
Instead of doing the triage in the front desk.
So maybe I'm at a kiosk, maybe.
Yeah, a kiosk, a QR code, even.
Okay.
A
Oh,
QR
on the
code, you
phone.
take a picture, and then on your phone you can do
Easy,
it.
easy.
Right? So this is how we are saving time for nurses so they can focus on doing what they do best, which is delivering care.
Okay. And does the information that I plug into Mediktor get into my electronic health record?
Yeah.
Okay. So
Yeah, we can integrate with any EHR, Epic, Cerner, you name it, and then we will pull actually the information that we need to run the assessment and then push the results.
interesting. Okay, okay.
Yeah.
Which makes sense because you said you're white labeling to a hospital.
Exactly.
You're not competing with them.
No,
In
not
any
at all.
way. What are you most excited about for the next, say, 12 months in terms of new partners?
Yeah, for
rollouts?
the 12 months, we would love to engage with hospitals' health systems for these new use cases because we believe that not only in 2024, but beyond, is going to be very relevant for them. So, ink a deal, start gathering data the same way we did with patient engagement and lead generation, so we can prove to the market that, Mediktor is not only for one use case, but for multiple use cases.
Yeah, yeah.
Right?
For creating greater efficiencies. Will that shift your marketing focus? You'll kind of change your messaging a little bit?
Yes,
Or
I
not
mean, we
yet?
have a growing footprint with patient generation and lead generation, so we are going to, devote some time there as well, but we want to open to other use cases, right? You
Okay.
always have to follow what the market is telling you.
Yeah.
And based on the conversations we are having, they want to move towards efficiency and productivity, so there we go.
I love
Without
it.
forgetting what we have done so far.
I love it. Vicenç, appreciate you giving me the update and coming by. You've been at this for 10 years with Mediktor?
6 years with Mediktor, the company has been around 11 years.
11 years, so I consider you, to have been doing the work on the ground, laying the, tracks for this really necessary work. So appreciate that persistence, and it's going to be exciting to see where you go next.
Sure, sounds great.
All
Thank
right,
you so much.
Vicenç, thank you.